Question 1. A client receiving gentamicin, 4 reports ringing in the ears. What is the nurse's priority action? A. Hold the next dose and notify the provider. B. Administer the dose with extra fluids. C. Encourage the client to rest in bed. D. Monitor blood pressure closely. Answer. A. Hold the next dose and notify the provider. Question 2. A nurse is preparing to administer potassium chloride for. What action is essential? A. Push the medication quickly over 5 minutes. B. Dilute in a compatible 4 fluid and infuse via pump. C. Mix with dextrose and administer IM. D. Check for pupil reaction before giving. Answer. B. Dilute in a compatible 4 fluid and infuse via pump. Question 3. Which medication should the nurse question in a patient allergic to sulfa drugs? A. Furosemide. B. Metoprolol. C. Lisinopril. D. Amoxicillin. Answer. A. Furosemide. Question 4. A client on lithium therapy shows signs of confusion, ataxia, and hand tremors. What is the nurse's best action? A. Hold lithium and obtain serum levels. B. Give next dose with food. C. Reassure and monitor for another hour. D. Offer fluids to flush the drug. Answer. A. Hold lithium and obtain serum levels. Question 5. A nurse receives an order to administer 4 morphine. Which finding requires immediate clarification? A. Respiratory rate of 8 breaths per minute. B. Pain score of 8 out of 10. C. Blood pressure of 110/72. D. Heart rate of 84 BPM. Answer. A. Respiratory rate of 8 breaths per minute. Question 6. Which medication should be withheld before a CT scan with 4 contrast? A. Metformin. B. Amlodipine. C. Levothyroxine. D. Acetaminophen. Answer. A. Metformin. Question 7. A nurse is caring for a child prescribed diphenhydramine. Which side effect is most concerning? A. Hyperactivity. B. Drowsiness. C. Dry mouth. D. Restlessness. Answer. A. Hyperactivity. Question 8. A client on warfarin has an INR of 4.2. What is the priority action? A. Hold the dose and notify the provider. B. Administer an additional dose. C. Give aspirin for pain control. D. Encourage dark green vegetables. Answer. A. Hold the dose and notify the provider. Question 9. A nurse is monitoring a client on clozapine. Which lab value is most important? A. WBC count. B. Serum sodium. C. Potassium level. D. Creatinine clearance. Answer. A. WBC count. Question 10. A nurse is reviewing medications for an elderly client. Which drug combination raises fall risk? A. Lorazepam and furosemide. B. Lisinopril and simvastatin. C. Omeprazole and amoxicillin. D. Acetaminophen and metformin. Answer. A. Lorazepam and furosemide. Question 11. A client reports persistent dry cough after starting lisinopril. What is the best nursing intervention? A. Notify provider. Expect change to ARB. B. Instruct to increase fluid intake. C. Suggest use of cough lozenges. D. Advise continuing medication and monitor. Answer. A. Notify provider. Expect change to ARB. Question 12. Which instruction is most important when teaching a client about nitroglycerin use? A. Sit or lie down before taking it. B. Take with food to avoid nausea. C. Swallow the tablet with water. D. Store in a warm, dry place. Answer. A. Sit or lie down before taking it. Question 13. A client taking allopurinol reports a mild rash. What is the nurse's priority action? A. Instruct client to stop medication and notify provider. B. Recommend hydrocortisone cream. C. Tell client to monitor rash for 2 days. D. Suggest increasing hydration. Answer: A. Instruct client to stop medication and notify provider. Question 14. Which client finding indicates a potentially serious side effect of atorvastatin? A. Muscle pain and weakness. B. Headache and blurred vision. C. Dry mouth and constipation. D. Mild abdominal bloating. Answer: A. Muscle pain and weakness. Question 15. What is the nurse's priority assessment after administering naloxone? A. Respiratory rate. B. Pupillary reaction. C. Pain level. D. Blood glucose. Answer: A. Respiratory rate. Question 16. Which action should a nurse take when administering subcutaneous enoxaparin? A. Inject into the abdomen and avoid massaging. B. Aspirate before injecting. C. Inject into the deltoid muscle. D. Administer with the air bubble removed. Answer: A. Inject into the abdomen and avoid massaging. Question 17. A client is prescribed phenytoin. Which statement indicates a need for further teaching? A. I'll stop taking it once my seizures stop. B. I'll keep my dental checkups regular. C. I'll avoid alcohol while on this drug. D. I'll notify the provider if I develop a rash. Answer: A. I'll stop taking it once my seizures stop. Question 18. Which client condition is contraindicated for beta blocker therapy? A. Asthma. B. Hypertension. C. Migraines. D. Anxiety. Answer: A. Asthma. Question 19. A nurse is preparing to administer insulin aspart. When should the meal tray be available? A. Within 5 to 10 minutes of injection. B. 30 minutes before injection. C. 1 hour after injection. D. No food needed with this insulin. Answer: A. Within 5 to 10 minutes of injection. Question 20. What is the best instruction to give a client starting doxycycline for acne? A. Avoid sun exposure and use sunscreen. B. Take it with milk for better absorption. C. Stop the drug once acne improves. D. Store it in the bathroom cabinet. Answer: A. Avoid sun exposure and use sunscreen. Question 21. A client prescribed vancomycin for develops flushing and hypotension during infusion. What should the nurse do first? A. Slow the infusion rate. B. Stop the medication permanently. C. Administer diphenhydramine 4. D. Elevate the head of the bed. Answer: A. Slow the infusion rate. Question 22. Which medication should the nurse question for a client with a history of peptic ulcer disease? A. Ibuprofen. B. Acetaminophen. C. Pantoprazole. D. Sucralfate. Answer: A. Ibuprofen. Question 23. A nurse prepares to give digoxin. Which assessment is most important before administration? A. Apical pulse for 1 minute. B. Respiratory rate. C. Pupillary response. D. Temperature. Answer: A. Apical pulse for 1 minute. Question 24. Which teaching is essential for a client prescribed levothyroxine? A. Take on an empty stomach in the morning. B. Take with food to reduce GI upset. C. Avoid grapefruit juice when taking it. D. Crush the tablet if difficulty swallowing. Answer: A. Take on an empty stomach in the morning. Question 25. A client on heparin has a PTT of 98 seconds. What is the nurse's best action? A. Hold the dose and notify the provider. B. Continue as ordered. C. Administer protamine sulfate. D. Increase the infusion rate. Answer: A. Hold the dose and notify the provider. Question 26. A client on rifampin reports orange-colored urine. What should the nurse do? A. Reassure the client this is expected. B. Stop the medication immediately. C. Collect a urine sample for culture. D. Call the provider to adjust the dose. Answer: A. Reassure the client this is expected. Question 27. Which medication requires peak and trough levels for safe administration? A. Vancomycin. B. Furosemide. C. Metoprolol. D. Loratadine. Answer: A. Vancomycin. Question 28. A client develops muscle rigidity and high fever while on haloperidol. What condition should the nurse suspect? A. Neuroleptic malignant syndrome. B. Tardive dyskinesia. C. Serotonin syndrome. D. Extrapyramidal reaction. Answer: A. Neuroleptic malignant syndrome. Question 29. A client is prescribed methotrexate for rheumatoid arthritis. Which teaching is priority? A. Avoid pregnancy while on this drug. B. Take with iron supplements. C. Increase dairy intake. D. Report dry mouth immediately. Answer: A. Avoid pregnancy while on this drug. Question 30. A nurse is preparing to administer for potassium. Which rule must be followed? A. Never give potassium for push. B. Administer undiluted via central line. C. Give IM if no 4 access is available. D. Administer with dextrose only. Answer: A. Never give potassium for push. Question 31. Which finding is most concerning in a client receiving clopidogrel? A. Black tarry stools. B. Mild headache. C. Occasional nausea. D. Bruising at foresight. Answer: A. Black tarry stools. Question 32. A client is receiving isoniazid. Which supplement is most important to prevent side effects? A. Vitamin B6. B. Vitamin C. C. Folic acid. D. Calcium. Answer: A. Vitamin B6. Question 33. Which client is at greatest risk for lithium toxicity? A. Client with dehydration and diarrhea. B. Client who is overweight. C. Client taking an SSRI. D. Client eating a low-sodium diet. Answer: A. Client with dehydration and diarrhea. Question 34. A client on methyldopa reports feeling extremely tired and dizzy. What should the nurse check first? A. Blood pressure. B. Pupils. C. Reflexes. D. Temperature. Answer: A. Blood pressure. Question 35. Which lab result is most important to monitor during statin therapy? A. Liver enzymes. B. Sodium level. C. Hemoglobin. D. Platelet count. Answer: A. Liver enzymes. Question 36. A nurse administers naloxone to a client with opioid overdose. What should the nurse monitor for next? A. Sudden return of pain or agitation. B. Hypertension and bradycardia. C. Elevated blood glucose. D. Pupillary dilation. Answer: A. Sudden return of pain or agitation. Question 37. A client is on hydroxychloroquine for lupus. Which complication must be monitored routinely? A. Vision changes. B. Hearing loss. C. Renal function. D. Cardiac rhythm. Answer: A. Vision changes. Question 38. A client on MAOIs asks about diet. What food should they avoid? A. Aged cheese. B. Fresh apples. C. Boiled eggs. D. Plain yogurt. Answer: A. Aged cheese. Question 39. What teaching is most important for a client prescribed spironolactone? A. Avoid potassium-rich foods. B. Take it with dairy to enhance absorption. C. Increase fluid intake significantly. D. Take it at bedtime to reduce dizziness. Answer. A. Avoid potassium-rich foods. Question 40. A client is taking carbamazepine. Which report by the client requires immediate attention? A. Sore throat and fever. B. Drowsiness and dry mouth. C. Mild nausea. D. Occasional headache. Answer. A. Sore throat and fever. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.